the two things that you can directly control.
Wondering if there are any tips to share for increasing HDL cholesterol. I realize this isn't directly HRT related. I can't seem to get mine above 37, which is much too low. Would rather see it in the 60s.
Yeah, I'll give you a couple of things. For starters, here at the clinic, we have a line of supplements, which is medical grade supplements. It's designed by a manufacturer that only designs pharmaceutical grade supplements, not over-the-counter stuff you buy on Amazon. They do not require a prescription, but they can only be provided by a healthcare professional. So we do have them available, and we ship them to patients. And I mention this because one of the supplements is called lipid support. And essentially, it's a quality niacin, because there's a couple of different niacins out there. It's a niacin that causes the histamine flush. And that has shown to have positive effects on elevating HDL, not only in our patients, but in actual studies. So that is one thing you could do from a pharmacological / supplement standpoint. The other thing you could do, because HDL is a little stubborn, it's not like LDL where nutritional changes to your diet are going to essentially effectively improve the numbers. HDL is one of the things that is more heavily impacted by activity. So low intensity steady state, sometimes you'll often see me post LISS, LISS, simply stands for low intensity steady state exercise. What does that mean? It's very simple. I'm going to give you like the short layman term version. Low intensity meaning not high intensity, and steady state meaning you are not fluctuating up and down. It's not an interval. It's just keeping your heart rate consistent for an extended period of time, usually anywhere from 20 to 40 minutes is plenty sufficient, 20, 30 minutes a day. And the way you want to perform this is you want to pick a task that you can maintain that heart rate without getting too tired and having to back off. So rather than running, try a walk. To make it a little more challenging than a traditional walk, maybe a slight incline. So if you're using a treadmill, you want to put maybe a 10, 15% incline, walk at 3.5 miles an hour. And I'm throwing out numbers based on the average. Some people may be fitter or less fit than that, and they may require adjustments. Rule of thumb I used to tell guys that I used to train for LISS was simply, if you can stay on the phone with me and carry on a conversation and I can't tell that you're exercising, then that's good. If I hear you huffing and puffing, you're probably moving out of that LISS zone, okay? So a rule of thumb is this: take the number 180, subtract your age, and that is the heart rate where you cross over from aerobic into anaerobic activity. That is where your body can no longer use oxygen to convert ATP into energy. So this oxidative process of aerobic activity becomes anaerobic. That's where lactic acid becomes the byproduct. That's where you feel the burn, the tightening of the chest. So 180 minus your age. So if you're 40 years old, 140 is that threshold. And again, this is going to have a variable for the fitness level of the individual. If you're a fit person, that number may be pushed up. And if you're very unfit, that number may be pushed down. Heck, there are guys out there that do nothing but lay on a couch all day. You get that guy's heart rate to 110, he's huffing and puffing, right? Even if he's not 70 years old. So at the end of the day, this is just a rule of thumb for an average fitness level. 180 minus your age, roughly that zone. What you want to do is be about 5-7 beats per minute below that zone. So I'm at 45, figure 135 is going to be my target heart rate to cross over into anaerobic. If I get on a treadmill at 127 or 130 beats per minute, and I hold it there for 30 minutes, I'm accomplishing the benefits of low intensity, steady state cardio. I'm allowing my heart muscles to relax. I'm allowing the elastic function. I'm reversing the effects of left ventricular hypertrophy. Perhaps I'm improving the cardiovascular and nitric oxide action of the endothelial lining within my veins and arteries. I'm allowing that expansion. I'm lowering my blood pressure. I'm helping to clear out plaque. I'm essentially working my lungs and my cardiovascular system by doing 20 to 30 minutes a day of this level of exercise. Find your LISS number, hold it for 20 to 30 minutes, and that should also help to increase your HDL numbers in addition to the supplement I spoke of. And then the last factor, unfortunately, we can't control. Genetics play a tremendous role on HDL. Some people just are lower and some are higher. Women in general tend to be higher on HDL than men. If you're using things like oral hormones, C17 alpha alkylated steroids, or anything of the sort, those will crush your HDL numbers as well. Okay, so we can go on about this forever, but I just gave you the two things that you can directly control. Okay,
Mhm.
the supplement and the LIS cardio should help to raise your HDL. And then obviously, lastly, if you've utilized a compound that crushed it, avoiding that will help it recover as well.